Good evening, everyone. I'm Cindy Herrick, National Campaigns Lead for 2020 Mom, and I'd like to welcome you to the fourth annual Moms Are Not Immune Candlelight Remembrance Vigil. This vigil is a part of our annual maternal suicide awareness campaign, which launched in 2018 to remember moms lost to maternal suicide and to close gaps in awareness about maternal suicide, one of the leading causes of maternal mortality. For years, there were misconceptions about pregnancy and the postpartum period about being protective against depression and suicide. We now know that this simply isn't true, and it's time to raise awareness about maternal depression and psychosis, leading causes of maternal suicide. Please join us in lighting a candle or even turning on the flashlight on your phone to remember those we have lost. If you are comfortable, share a photo of your candle on social media and tag 2020 Mom using the following hashtags when you post. Hashtag Moms Are Not Immune and hashtag Maternal Suicide Awareness. The moms we remember and honor tonight can be found under the Remembrance Wall tab on the right side of our homepage at www.2020mom.org. 2020 Mom believes that every mother lost to suicide during the perinatal period should be remembered and honored. Mothers, your loss fuels us and this important work. We honor you and all those you left behind. Your loss matters, and we are working hard to prevent others from appearing on this wall in the future. Before we move on to the vigil, I wanted to say that Stephen D'Achilles from the Alexis Joy D'Achilles Foundation was originally scheduled to join us tonight, but unfortunately had a conflict. Thank you, Stephen, for hosting our past vigils, and we are grateful for your continued partnership and dedication to maternal mental health. I'd now like to introduce our hosts of the Candlelight Vigil tonight. Dr. Kara Zivin, a mom with lived experience and professor of psychiatry, obstetrics, gynecology, and health management and policy at the University of Michigan, and Suzanne Nelson, a new mom who lost her twin sister to postpartum psychosis. Thank you for joining us tonight, Kara and Suzanne.
Good evening. I am honored and humbled to join all of you here tonight. I am based now in Michigan, but I am originally from California. I have gotten to know Joy and others from 2020 Mom over recent years as I've become more open publicly about my own experiences with perinatal mental illness. I will be honest that I'm late in coming to this program and I have many mixed feelings, and I don't have them all neatly packaged to share with you tonight. I have spent over a decade trying to understand and make peace with my experience, which has included pursuing a degree in writing. I thought that tonight I would read you some of the introductory portions of my book length manuscript titled Lexicon of My Emergence Beyond Perinatal Depression. I'd like to start with an epigraph. It's clear that antenatal depression exists, but it's not clear what should be done for it. We know too little, and none of the options are uncomplicated. But understanding some of the complexities might help millions of women who confront this condition feel less alone and make more informed decisions. That's Andrew Solomon. How can I stop thinking about the disease long enough to write about anything else? How can I stop thinking about everything else long enough that I can write about the disease? Sarah Mancuso. In February 2011, during my 8th month of my first and only pregnancy, a pregnancy that I wanted, I ingested large handfuls of multiple psychotropic medications, aiming to end my life after over 6 months of unrelenting anxiety, depression, and insomnia. Both my son and I survived, and ultimately we thrived. But not a day goes by that I do not appreciate our good fortune, and not a day goes by that I do not regret. My illness and its treatment left me with gaps, holes in my memories, shame, guilt, and deafening silences. My profession as a mental health and policy researcher, before, during, and after my pregnancy, led me here to quantify and qualify, to write about and seek to understand what happened and why it has remained omnipresent in my life. I've written about and spoken about my experiences, particularly recently after Meghan Markle shared her experiences with suicidality during pregnancy earlier this year. I've also conducted scientific research funded by National Institutes of Health, state governments, and foundations on the costs of untreated perinatal depression and the impacts of various policies, as well as the burden of illness and the need for clinical and policy attention to this issue. I'm honored to be here to try to support other mothers and families who have struggled during pregnancy and postpartum, including those that are no longer with us. I stand in solidarity with all of you tonight as we remember. Thank you.
Good evening. My name is Suzanne Nelson. I'm a mom based in Indianapolis, Indiana. Thank you to 2020 Mom for organizing such a meaningful event. I'm here tonight to honor and remember my twin sister, Melissa McGill Church, along with all mothers lost to maternal suicide. My sister and I found out we were pregnant within only a couple of weeks of each other in early January of 2020. We could not be happier that we were going through our very first pregnancies together. We were as close as twins get. We did everything together, so it was only fitting that we welcome our first babies into this world at the same time. I knew going through this pregnancy with her was going to be one of the best experiences of our lives, and it really was. From long walks and prenatal yoga to planning Melissa's wedding and our joint baby shower, it was a beautiful time, despite navigating through a pandemic. I delivered my baby girl, Millie Melissa, on September 8th via planned C-section. Melissa anxiously awaited the arrival of her baby boy, and finally, after being induced at 41 weeks, she gave birth to her beautiful son, Henry. It was a long and grueling labor. Melissa pushed for 4 hours, refusing to give up. I was so proud of her. She was so determined and so strong. I couldn't wait to meet my nephew and hug my sister. Melissa was so happy. She sent picture after picture of their new, beautiful, healthy baby boy. After about 2 days, they were released from the hospital and headed home. Their first night at home was very tough with no sleep, and that's when we believed things started to take a turn. I got a couple phone calls from Melissa's husband, Brian, asking if I could try to help calm Melissa down and reassure her that everything was okay with Henry. She was fixating on his hands and his hips, convinced something was wrong with him. Melissa was an occupational therapist, so we thought her training and expertise was kicking in, causing her to be overly worried. They took Henry to his first pediatric appointment that morning, and thankfully, Henry was a healthy boy, and the doctor tried to assure her that nothing was wrong. Because Brian sensed something was not right with Melissa, he asked the doctor, which was also their primary care physician, if she could prescribe something to help Melissa get some sleep and to help with the anxiety. Shortly after that appointment, our mom arrived at their house to help care for Melissa and the baby. Melissa did not look well. She had gotten no sleep in days. She was distant and quiet and not herself. She took our mom into her bedroom and held her hand. She looked into my mom's eyes and said, "I can't do this." My mom desperately tried to get more out of her, to try to get her to explain what it was she felt so helpless about. She then told my mom, "I need to go to the ER." At that point, they knew things were really not right and knew she needed help. Brian took her to the hospital. Once she was evaluated by the doctor there, they determined she would be best cared for in a behavioral health clinic. She was taken from the hospital by ambulance to the facility. Melissa stayed in that facility for roughly 48 hours. She had limited communication with Brian, and I was never able to reach her by phone while she was there. On the second day, she told the doctor she was ready to go home and to be with her baby. The doctor released her with no diagnosis, only a phone number to their facility, the hotline for Postpartum Support International, and prescriptions for an antidepressant and a sleeping aid. When she got home, our parents and her husband tried caring for her in every way they thought was best. We were all hopeful that things were going to get better. But only one night had passed since she'd been home. I got a phone call from her husband. He told me that Melissa had left the house after they had gotten ready for bed, only to find her walking 4 or 5 houses down the street outside of their home. As he approached her, he kept calling out her name, but she wouldn't turn around. He grabbed her arm to get her to stop walking, and as she turned around, she looked startled and confused. She was cradling her purse and her phone in her arms. Brian walked her back to the house. They got back in bed together and then called me. I asked Melissa how she was feeling, if she felt safe, or if she was planning on leaving the house again. She reassured me in her quiet, distant voice that she was okay and that she wasn't going to leave. We pleaded for her to get some sleep first thing in the morning and that I loved her so much. Melissa that next morning. Instead, I received a call from Brian, panicked, saying that Melissa had left the house again, but this time she took the car. He had realized it about 20 minutes after she had left, looking for her, and was hoping she was heading to my house. I ran downstairs to turn the lights on, and I hurried outside to see if her car was in sight. Melissa never showed. Each passing minute, we all grew more and more worried. As the minutes turned into hours, no sign of Melissa. I knew this wasn't good. I called Brian asking for an update. I could tell by the silence and the low, broken voice that the news was not good. Brian had to hand the phone to my dad, and that's how I learned we had lost her. She had taken her own life at a trail close to their home exactly 1 week after her son was born. The world stood still in that moment. Our sweet Melissa was gone, and Henry was left without his mom, and Brian was left without his wife. We learned shortly after her death that she was suffering from postpartum psychosis, a term we never heard of, a condition we never knew existed. Our lives have been turned upside down by a tragedy that should not have happened. The care for a woman during their postpartum period is extremely limited, almost non-existent, but it's the time they need to be cared for the most. The fourth trimester needs a complete overhaul as it pertains to our healthcare system. We need to reinforce the importance of this fragile time for mothers and propose a new paradigm for postpartum care. I am here today because of Melissa and her tragic and sudden departure from this world. It fuels me to share her story and spread awareness of postpartum psychosis. We are powered by the strength in knowing Mel's death is not without meaning, and that it continues to educate women and their families, friends, healthcare professionals, so that this kind of tragedy does not happen again. No child should be left to grow up without their mom. No partner should have to raise their child alone because of a lack of awareness of how real this condition is. We must do better for our new mothers. We must work alongside and help organizations like 2020 Mom close these huge gaps in maternal mental care. I apologize for all the tears. Now we'll be remembering all the mothers lost to maternal suicide. Melissa McGill Church, Shalane Bryant Gatos, Andrea Campanari, Jean Marie Cardis Nowicki.
Sasha Hedich, Lieutenant Commander Annie Imlay Spangle, Stephanie Clear Pecora, Sarah Walker Judson.
Mary Ellen Moffett, Holly Marie Bloom, Christy Elmore Langdon, Amy Garvey.
Christina LaShawn Thompson Adams, Cassandra Ashley Vaughn Perkins, Tammy Levette, Melanie Blocker Stokes.
Stacy Ann Gottwalt, Brittany Butt, Jean Mudd Hoftailing, Desiree Istersill.
Alexis Joy D'Achilles, Carol Pierce Sukakos, Kara Kovlikas, Brianna Renshaw,
Charlene Ventanilla, Alana Marie Lonnie McManus de Pasquale, Cindy Wackenheim, Janet Gifford Myers,
Emily Cook Duchess, Amy Elizabeth Ziegler, Susan Mahfouz Sarsoni, Allison Matthews Goldstein,
Christy Marie Kuvalon Wise, Ruth Roden Craven, Jennifer Lynn Narr, Kelly Abraham Martinez,
Beth Halverson Flack, Elizabeth Orzel Ludlam, Jennifer Travassos, Laura Belizaire,
Cassandra A. Williams, Jennifer Gibbs Bankston, Jane Leslie, Brenda Encarnacion.
Now please join us in lighting a candle to honor and remember all these moms lost. I wanted to have a special thank you to Kara and Suzanne for sharing their stories and hosting tonight. We so appreciate both of you and the strength it takes to share your stories. For more information on maternal suicide, please visit www.2020mom.org/maternal-suicide. Thank you all so much for joining us for this vigil tonight. Good night, everyone. Thank you.